Hello, future nurses, current nurses, and everyone passionate about learning nursing fundamentals. Welcome to my channel. I'm Marcia, a PHRN and USRN, and today we're diving into an advanced NCLEX style review session. Whether you're preparing for the NCLEX, reviewing for a nursing exam, or a practicing nurse wanting to refresh your skills, this session is tailored just for you. In this video, we'll tackle 50 NCLEX style questions designed to strengthen your understanding of nursing fundamentals. These aren't just any questions. They include multiple choice, select all that apply, or SATA, true or false, fill in the blank, and scenario-based questions to challenge your critical thinking. Here's a quick preview of what we'll cover. Patient safety and infection control, essential for safe nursing practice. Basic care and comfort, meeting patients' needs with compassion. Vital signs and assessment, detecting changes before they become emergencies. Hygiene and mobility, preserving dignity while preventing complications. Nutrition and hydration, addressing basic needs for health and recovery. Elimination needs, managing bowel and bladder care. Documentation and communication, the backbone of effective nursing practice. Pharmacology fundamentals, safe and accurate medication administration. Cultural and ethical considerations, providing care that respects diversity. End-of-life care and patient advocacy, delivering compassionate care in critical moments. These questions go beyond memorization. They'll help you apply knowledge in real-world scenarios and get exam ready. So grab a notebook, pause the video to answer questions, and leave your responses in the comments. And if you're new here, subscribe for more advanced nursing reviews. Let's dive in. Segment 1, Patient Safety and Infection Control. Question 1, Case Scenario. A 58-year-old patient with a history of diabetes and a chronic wound on their left foot is admitted for infection management. Upon entering the room, the nurse notes, the wound dressing is saturated with drainage. The patient's blood glucose is 280 mg per dl. The patient is not wearing the ordered compression socks due to discomfort. What should the nurse prioritize first? A. Administering prescribed insulin to manage blood glucose levels. B. Reapplying compression socks to prevent further edema. C. Replacing the wound dressing with sterile technique. D. Notifying the healthcare provider about the findings. Answer. C. Rationale. Replacing the saturated dressing reduces the risk of further infection. Controlling blood glucose and managing edema are important, but not the immediate priority. Question 2. SATA. Which nursing interventions minimize the risk of healthcare-associated infections, HAIs? A. Using sterile gloves for all patient care tasks. B. Performing hand hygiene before and after patient contact. C. Disinfecting shared medical equipment between patients. D. Administering prophylactic antibiotics for every surgical patient. E. Educating patients about proper respiratory hygiene. Answer B, C, E. Rationale. Effective infection control involves proper hand hygiene, equipment disinfection, and patient education on respiratory hygiene. Sterile gloves and prophylactic antibiotics are more specific and not universally required. Question 3. Multiple choice. A nurse is caring for a patient colonized with a multi-drug resistant organism, MDRO. Which action is correct? A. Wearing gloves but skipping the gown since there is no active infection. B. Disposing of the patient's tray in regular trash. C. Using dedicated equipment like stethoscopes and blood pressure cuffs. D. Allowing visitors without PPE, provided they avoid direct contact. Answer C. Rationale. Using dedicated equipment prevents cross-contamination. Proper precautions, including gloves and gowns, are necessary even for colonization. Question 4. Fill in the blank infection control measures include using precautions for all patients regardless of diagnosis. Answer. Standard. Rationale. Standard precautions are fundamental to preventing infection transmission in any healthcare setting. Question 5. True or false negative pressure rooms are required for patients with droplet isolation precautions. Answer. False. Rationale. Negative pressure rooms are specifically for airborne precautions, not droplet precautions. Segment 2. Basic care and comfort. Question 6. Case scenario. A patient recovering from abdominal surgery reports severe pain, 810, and refuses medication, stating they prefer non-pharmacological methods. What should the nurse do next? A. Respect the patient's decision and reassess in 30 minutes. B. Teach and assist the patient with guided imagery or relaxation techniques. C. Administer the prescribed analgesic despite the patient's refusal. D. Document the refusal and notify the healthcare provider. Answer B. Rationale. Offering non-pharmacological pain management respects patient autonomy and addresses their immediate need. Administering medication against the patient's wishes violates their rights. Question 7. SATA. Which interventions help prevent pressure injuries in a bedridden patient? A. Repositioning the patient every 2 hours. B. Using a donut-shaped cushion under the sacrum. C. Applying a moisture barrier cream to intact skin. D. Elevating the head of the bed to 45 degrees at all times. E. Keeping the skin clean and dry. Answer A, C, E. Rationale. Regular repositioning, skin protection, and maintaining dryness are key to preventing pressure injuries. Donut cushions increase pressure injury risk. Question 8. A nurse is positioning a patient with left-sided pneumonia. Which position is most beneficial? A. Supine. B. Left lateral. C. Right lateral. D. High Fowler's. Answer C. Rationale. Placing the unaffected lung down improves ventilation, perfusion matching, and oxygenation. Question 9. Pain relief measures include both and non-pharmacological interventions. Answer pharmacological. Rationale. Effective pain management combines pharmacological treatments with holistic approaches like relaxation techniques. Question 10. Elevating the legs above the heart is contraindicated for patients with chronic venous insufficiency. Answer false. Rationale. Elevating the legs reduces venous stasis and improves circulation in venous insufficiency. Excellent work. These foundational skills are critical for patient care. Next, we're moving on to vital signs and assessment, where we'll dive deeper into early warning signs and prioritization. Segment 3. Question 11. A patient's blood pressure is 8850 mmHg with a heart rate of 120 bpm. The patient reports dizziness and confusion. What is the nurse's priority action? A. Recheck the blood pressure in 15 minutes. B. Administer prescribed IV fluids. C. Place the patient in a supine position with legs elevated. D. Notify the healthcare provider immediately. Answer C. Rationale. Placing the patient in a Trendelenburg-like position, legs elevated, improves venous return, increasing blood pressure and perfusion to vital organs. IV fluids may follow if ordered, but immediate positioning is essential to prevent worsening hypotension and organ damage. Question 12. Which findings indicate potential sepsis in a patient with a suspected infection? A. Heart rate of 110 bpm. B. Respiratory rate of 24 breaths per minute. C. Blood pressure of 120/80 mmHg. D. Temperature of 101.5 degrees Celsius, 38.6 Dur. E. Urine output of 15 millihor in the last 2 hours. Answer A, B, D, E. Rationale. Signs of systemic inflammatory response syndrome, SIRS, include tachycardia, tachypnea, fever, and decreased urine output. A normal blood pressure does not rule out sepsis, especially in compensated states. Question 13. Which assessment finding in a postoperative patient requires immediate intervention? A. Respiratory rate of 18 breaths per minute. B. Pulse oximetry reading of 90% on room air. C. Pain level of 610. D. Blood pressure of 140/90 mmHg. Answer B. Rationale. A pulse oximetry reading of 90% indicates potential hypoxemia and requires intervention to prevent respiratory compromise. Other findings, while potentially concerning, are not immediately life-threatening. Question 14. The blank. Pulse is the most accurate site to assess a patient's heart rate during cardiac arrest in adults. Answer: carotid. Rationale: the carotid pulse is most accessible and reliable in adults during emergencies, as peripheral pulses may not be palpable in cardiac arrest. Question 15. True or false? A widened pulse pressure is always indicative of hypovolemic shock. Answer: false. Rationale: a widened pulse pressure can occur in conditions like aortic regurgitation or septic shock, not exclusively in hypovolemic shock. Narrowing pulse pressure is more characteristic of hypovolemic shock. Segment 4. Hygiene and Mobility. Question 16. A patient with limited mobility is at risk for developing a pressure injury. The nurse observes redness on the sacral area that does not blanch with pressure. What stage of pressure injury is this? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Answer: A. Rationale: non-blanchable erythema indicates a stage 1 pressure injury. Early detection and intervention are crucial to prevent progression. Question 17. SATA. Which interventions are appropriate for preventing complications of immobility? A. Performing passive range of motion exercises. B. Encouraging hourly deep breathing and coughing exercises. C. Applying compression stockings as prescribed. D. Positioning the patient in the same position every 8 hours. E. Increasing protein intake to promote tissue healing. Answer: A, B, C, E. Rationale: immobility interventions include range of motion exercises to prevent contractures, breathing exercises to reduce atelectasis risk, compression stockings for DVT prevention, and a high-protein diet for tissue repair. Frequent repositioning is required, not every 8 hours. Question 18. Multiple choice. A patient with a fractured femur develops sudden shortness of breath and chest pain. Which condition should the nurse suspect? A. Atelectasis. B. Pulmonary embolism. C. Pneumothorax. D. Fat embolism syndrome. Answer: D. Rationale: a patient with a long bone fracture is at high risk for fat embolism syndrome, which presents with respiratory distress, chest pain, and petechial rash. Question 19. When assisting a patient with transferring from bed to wheelchair, the nurse should use a blank to reduce fall risk. Answer: gait belt. Rationale: a gait belt provides additional support and stability during transfers, reducing the risk of falls. Question 20. True or false footboards are effective in preventing foot drop in immobile patients? Answer: true. Rationale: footboards maintain proper foot alignment and prevent contractures associated with foot drop. Segment 5. Nutrition and hydration. Question 21. A patient with chronic kidney disease has a potassium level of 6.4 μQ per L. Which food should the nurse recommend avoiding? A. Apples. B. Bananas. C. Rice. D. Broccoli. Answer: B. Rationale: bananas are high in potassium and should be avoided in hyperkalemia. Apples, rice, and broccoli are lower potassium options suitable for this patient population. Question 22. SATA. A nurse is caring for a patient who has been prescribed enteral nutrition via a nasogastric NG tube. Which interventions ensure safe and effective delivery? A. Checking residual volumes every 4 hours. B. Keeping the head of the bed elevated to at least 30 degrees. C. Flushing the tube with sterile water before and after feedings. D. Administering feedings at room temperature. E. Verifying NG tube placement before initiating feedings. Answer: A, B, D, E. Rationale: key interventions include residual volume checks, head elevation to prevent aspiration, using room temperature feeds, and verifying tube placement. Flushing with sterile water may be necessary in immunocompromised patients, but is not routine for all patients. Question 24. For patients receiving continuous enteral feedings, the head of the bed must remain elevated to at least 4 blank degrees to reduce aspiration risk. Answer: 30. Rationale: maintaining a minimum of 30 degrees reduces the risk of aspiration pneumonia in patients on continuous feeds. Question 25. True or false, parenteral nutrition is administered via a peripheral IV? Answer: false. Rationale: parenteral nutrition is administered through a central venous catheter because it is hypertonic and can cause irritation or damage to peripheral veins. Segment 6, Elimination Needs. Question 26. A patient with a urinary catheter has cloudy urine with a strong odor. The nurse observes a temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius. What is the nurse's priority action? A. Irrigate the catheter with sterile saline. B. Obtain a urine sample for culture and sensitivity. C. Encourage increased oral fluid intake. D. Replace the catheter and notify the provider. Answer: B. Rationale: a urine sample is essential for identifying the causative organism and guiding treatment. Replacing the catheter may follow based on provider orders. Question 27. SATA. Which interventions promote healthy bowel elimination? A. Encouraging high-fiber foods. B. Increasing fluid intake to 2 to 3 liters per day. C. Administering laxatives daily. D. Encouraging ambulation. E. Providing privacy during toileting. Answer: A, B, D, E. Rationale: healthy elimination involves fiber, adequate hydration, physical activity, and privacy. Daily laxatives are not appropriate unless prescribed for specific conditions. Question 28. Multiple choice. A nurse is caring for a patient with a new ileostomy. Which finding requires immediate intervention? A. Stoma is pink and moist. B. Output is $1,000 mLO over 24 hours. C. Stoma is purple and dry. D. Patient reports mild gas and bloating. Answer: C. Rationale: a purple dry stoma indicates compromised blood flow and requires immediate attention. Pink, moist stomas and increased output are normal findings for ileostomies. Question 29. Fill in the blank. A. Blank. Catheter is used for short-term management of urinary retention. Answer: straight. Rationale: straight catheters are inserted for immediate drainage and removed after use, unlike indwelling catheters. Question 30. True or false? An ileostomy patient is at higher risk for dehydration compared to a colostomy patient. Answer: true. Rationale: ileostomies bypass the colon, reducing water absorption and increasing the risk of dehydration. Segment 7. Documentation and communication. Question 31. A nurse observes a colleague documenting an assessment for a patient they did not assess. What is the nurse's best action? A. Report the incident to the charge nurse immediately. B. Confront the colleague in front of the patient. C. Document the observation in the patient's chart. D. Ignore the behavior to avoid conflict. Answer: A. Rationale: falsified documentation compromises patient safety and must be reported to the appropriate authority. Question 32. SATA. Which principles ensure accurate and effective nursing documentation? A. Using factual, objective language. B. Charting care after the end of the shift. C. Correcting errors with a single line and initials. D. Using abbreviations from an approved list. E. Documenting patient care immediately after completing it. Answer: A, C, D, E. Rationale: accurate documentation requires timely entries, factual language, and corrections made appropriately. Delaying charting increases the risk of errors. Question 33. Multiple choice. When giving an SPA report, what should the nurse include in the S, situation section? A. the patient's full medical history. B. The primary reason for contacting the provider. C. Current vital signs. D. Recommended actions. Answer: B. Rationale. The situation section includes the immediate reason for the communication, such as a new symptom or change in condition. Question 34. In nursing documentation, avoid a blank. Statements such as, patient seems fine. Answer: subjective. Rationale. Charting should include objective, measurable data rather than vague or subjective descriptions. Question 35. True or false? The patient's chart is a legal document that can be used in court. Answer: true. Rationale. The medical record is a legal document that must accurately reflect patient care to protect both the patient and healthcare providers. Segment Pharmacology Fundamentals. Question 36. Case scenario. A patient prescribed warfarin, Coumadin, has an INR of 5.2 and reports mild bleeding from their gums. What is the nurse's priority action? A. Administer the next scheduled dose of warfarin as prescribed. B. Hold the warfarin and notify the healthcare provider. C. Instruct the patient to increase dietary vitamin K intake. D. Encourage the patient to use a soft bristled toothbrush. Answer: B. Rationale. An INR of 5.2 indicates a high risk of bleeding. The nurse should hold the medication and notify the provider for further orders. Increasing vitamin K intake or using a soft toothbrush may help, but is not the immediate priority. Question 37. SATA. The nurse is preparing to administer digoxin to a patient. Which of the following assessments should be completed before administration? A. Apical heart rate. B. Blood pressure. C. Potassium level. D. Respiratory rate. E. Vision changes. Answer: A. C. Rationale. Apical heart rate should be assessed because digoxin can cause bradycardia. Potassium levels are important because hypokalemia increases the risk of digoxin toxicity. Question 38. Multiple choice. A patient is prescribed a high alert medication. What is the nurse's best action before administration? A. Administer the medication immediately to prevent delays. B. Confirm the order with the healthcare provider. C. Perform an independent double check with another licensed nurse. D. Verify the patient's identity using one identifier. Answer: C. Rationale. High alert medications require a double check by 2 licensed nurses to ensure safety and prevent errors. Question 39. Fill in the blank blank is the preferred route for rapid medication absorption during an anaphylactic reaction. Answer: intramuscular M. Rationale. IM administration of epinephrine is the preferred route for rapid absorption during anaphylaxis. Question 40. True or false antibiotics should always be given on an empty stomach for better absorption? Answer: false. Rationale. Some antibiotics, such as amoxicillin, can be taken with food to reduce gastrointestinal upset, while others may require an empty stomach for optimal absorption. Segment 9. Cultural and ethical considerations. Question 41. Case scenario. A nurse is caring for a Muslim patient who is fasting during Ramadan. The patient refuses all oral medications during daylight hours. What is the best nursing action? A. Administer all medications after sunset as the patient requests. B. Inform the patient that fasting must be stopped due to medical necessity. C. Collaborate with the healthcare provider to adjust the medication schedule. D. Document the patient's non-compliance with the prescribed regimen. Answer: C. Rationale. The nurse should collaborate with the provider to accommodate the patient's cultural and religious practices while ensuring their health needs are met. Question 42. SATA. Which nursing interventions demonstrate cultural competence? A. Avoiding eye contact with patients from cultures that view it as disrespectful. B. Using a certified medical interpreter for non-English speaking patients. C. educating patients on why their cultural practices should not interfere with care. D. Providing meals consistent with the patient's dietary restrictions. E. Asking open-ended questions to understand the patient's cultural preferences. Answer: A, B, D, E. Rationale. Cultural competence involves respecting cultural differences, using interpreters as needed, and accommodating dietary and care preferences. Question 43. Multiple choice. A patient refuses a blood transfusion due to religious beliefs. What is the nurse's best response? A. Administer the transfusion to prevent harm. B. Document the refusal and notify the healthcare provider. C. Explain the importance of the transfusion and convince the patient to accept it. D. Notify the ethics committee immediately. Answer: B. Rationale. The nurse must respect the patient's autonomy, document the refusal, and inform the provider for alternative care plans. Question 44. The ethical principle of blank refers to respecting a patient's right to make their own healthcare decisions. Answer: autonomy. Rationale. Autonomy is the right of patients to make informed decisions about their own care. Question 45. True or false? Cultural humility is the belief that healthcare providers are experts on their patients' cultures. Answer: false. Rationale. Cultural humility involves recognizing that patients are the experts on their own culture and requires healthcare providers to learn from them. Segment 10. End-of-life care and patient advocacy. Question 46. Case scenario. A patient in hospice care reports pain that is unrelieved by the current medication regimen. The family expresses concern about increasing the dosage due to fear of addiction. What is the nurse's best action? A. Reassure the family that addiction is not a concern in end-of-life care. B. Educate the family on the purpose of pain management in hospice care. C. Notify the provider to adjust the pain medication dosage. D. All of the above. Answer: D. Rationale. Pain relief is a priority in hospice care, and addressing family concerns with education and provider collaboration is essential. Question 47. SATA. Which nursing interventions provide emotional support to a dying patient? A. Offering to contact a chaplain or spiritual advisor. B. Encouraging the patient to express fears and concerns. C. Remaining silent when the patient discusses death. D. Providing factual information about the dying process. E. Using therapeutic touch, such as holding the patient's hand. Answer: A, B, D, E. Rationale. Emotional support includes spiritual care, open communication, providing information, and therapeutic touch. Question 48. What is the nurse's priority when caring for a patient who has a DNR, do not resuscitate order? A. Ensure the patient's family agrees with the DNR order. B. Provide comfort measures and address symptoms as they arise. C. Avoid discussing the DNR status with the patient. D. Resuscitate if the family requests it despite the order. Answer: B. Rationale. The nurse's priority is to provide comfort care and symptom management in accordance with the DNR order. Question 49. Fill in the blank. Hospice care focuses on blank care, which prioritizes comfort and quality of life. Answer: palliative. Rationale. Hospice care emphasizes palliative care, focusing on comfort and support rather than curative treatments. Question 50. True or false? Pain is a normal part of the dying process and should not require treatment. Answer: false. Rationale. Pain is not inevitable and must be managed effectively to ensure the patient's comfort and dignity during end-of-life care. Congratulations! You've just completed 50 advanced NCLEX-style questions covering the fundamentals of nursing. From patient safety to pharmacology, we've tackled the most critical and challenging topics. These questions were tough, but with consistent practice, you're building the knowledge and confidence you need to succeed. If you found this helpful, please like this video, share it with your friends, and subscribe for more in-depth nursing reviews. Thank you for joining me today. Remember, nursing is more than a career, it's a calling. Keep working hard, and you'll make a difference in countless lives. See you in the next video.